Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
So that this new development may allow some organs to be transplanted without the need for immunosuppression, which I think is a critical new development. So I thought I'd share that with you. It's brand new news that isn't yet available on the literature because it just came out this week.
Cal, I had a question about the repairs that might be done on an organ. What type of repairs are you talking about?
Well, one would be if, for example, there's an infection, you can treat an organ with antibiotics and eliminate that infection. Or if it's damaged, you can actually repair the organ and get it to heal. So some organs are repairable, and I guess some aren't. But that's the kind of damage I'm talking about. The damage that from even you could have a benign tumor that could be removed and fixed on the machine.
Okay. I did check my email list. You're on the list, so maybe you can check your spam folder just in case.
No, I did. It's not on there. I didn't receive it.
At howard.edu, right?
Yeah, I got your Chris, but I did not receive the article.
Okay.
Yeah. So, but anyway, those are two. And then, of course, this week they had an excellent article on of course, that article on the repair of the liver, but they also had an article on beating the heat. We talked about heat exhaustion and heat stroke last week, but they had a very excellent article on heat stroke, how to prevent it, as we talked about, and also how to know when you have heat exhaustion, and what are the warning signs, and how and also answer a question about that someone had raised about how much water should you drink and when you should drink it and that kind of thing. Because it's sometimes people just drink. But I think one of the things that Daryl had suggested was, and that's true for people who have normal kidneys, and that is if your urine is clear, yellow, light yellow, watery, then it means that you're not dehydrated. On the other hand, if it gets yellow, brown, dark yellow, dark brown, then you mean you're dehydrated and you need to drink a lot of water.
Also,
yes.
Is there a recommended amount of water that we should take in each day? And if we fall well below that, would it have any negative effects?
Yeah, I think 1 to 2 liters a day is reasonable for most people. When it gets hot, then you may need more. And one of the ways to tell if you don't have kidney trouble is your urine will be clear or light yellow. On the other hand, if you have kidney failure, then you don't have the capacity to concentrate. So in that situation, it will be difficult for you to know. So the best advice is to drink if it gets hot, whatever you drink, whatever amount you used to drink more than that. The temperature at which you have to worry about is, for example, I was in Phoenix, Arizona. It was 114 degrees. And at that temperature, you can fry eggs on the sidewalk. So when you get over 100 degrees, then you should be in a place that has air conditioning. And if you are not in a place that has air conditioning, then you need to find a place because just like you can fry eggs on the street, your tissues burn up as well. So
My son and granddaughter, they drink, to me, an enormous amount of water each day. They have, it's a supposed name brand container and it's metal. And to me, it looks like a gallon almost, at least close to it. And they fill it up all day long. And she takes hers to school. So much so until when she got ready to graduate, they told her, Kayla, you will not take that thermos with you to the graduation. And it's a fat metal thing. But I, on the other hand, I can start with the regular plastic bottle. What's that, 16 ounces? Shamefully, the next day, I'm still sipping from that. And my family is getting on me and I'm trying to be aware of it. I just don't take in a lot of liquids, which is totally the opposite of them. They'll fill this container up at least 3-4 times a day. And it goes where they go. It's like an extension of them. So I guess I'm the one that needs to do more. I'm just wondering what bad effects am I having? And you spoke about the color of the urine. That's not necessarily the case for me. It seems normal, I guess, even though I know I'm not taking in water.
well, then you're not taking in too little water then, because the sign of the fact that you're not taking enough water is when your urine turns dark.
Okay.
And you're hemoconcentrated. So that's a sign. As long as the urine is light yellow, that's a sign that you're adequately hydrated. And if you stay in an air-conditioned environment, then the heat exhaustion issue does not become a factor.
Okay.
Good morning. Good morning, Dr. Callender and everyone. This is Elizabeth. One research that I use a lot, recommend, and everything that is suggested to us as wellness coach is backed by a medical and scientific board, but it's also, we often have to say, it's for the average person. And it is suggested that at least 1/2 of their body weight should be contained water.
Also, oh, by the way, Dr. Canterbury, I see Dr. Canterbury is here. You have any comments about heat exhaustion, what to do in this hot weather?
I'm sorry, I just came in on the end of the conversation, but certainly, as you were saying, that staying hydrated is important. Everybody, it's not just water. People think we drink just water, but there are other things that we consume that will add to the amount of liquid that our bodies need. So while you may be drinking water, then you may also be consuming other things, other forms of liquid that can add to your total volume. So sometimes we underestimate how much how much we're consuming. So you have to look at everything. And sometimes we say, even think about the gravies or the soups or other things that may have liquid in them that will contribute to that. But certainly then they're young and healthy and your kidneys are working well, then they may, what goes in comes out. The only thing with drinking too much water is making sure your sodium, it doesn't drop your sodium. So from that perspective, if they're tolerating it, is fine. And if you don't feel like you're dehydrated and you're, like Dr. Kellen said, your urine is nice and clear, then that may be appropriate for you because you may be getting it in other forms also. Thank you.
And I think a point that Velma made that sometimes is not appreciated is that you can overhydrate. And as she mentioned, hyponatremia or low sodium can cause a lot of problems in itself. So yes, you can overdo it. But for the most part, if you're drinking a lot of water and your urine is yellow, then you're probably not overhydrating. But overhydration can cause as many problems as dehydration. So neither extreme is desirable. I think last time we talked somewhat about heat stroke, and we didn't talk much about heat exhaustion, although Darrell did mention how he had demonstrated heat exhaustion at one point. But there are extremes of heat exhaustion as well. And sometimes it starts off as cramps. And then sometimes, and I think one of the things that John Buchanan mentioned is that when you stop sweating, you know you're in trouble, because then you're likely to go from heat exhaustion to heat stroke. And either of those conditions is associated with falling out or dying, as a matter of fact. And so some of the early signs of heat exhaustion are first heavy sweating, increased heart rate, dizziness, as Darrell had mentioned before, headaches, fatigue, and just not feeling right. And when that happens, you need to get away from whatever you're doing and get into air-conditioned environment as quickly as possible. Yes.
Yeah, I have a list of signs of heat exhaustion. Okay.
Right.
Heat exhaustion, not heat stroke. Heat exhaustion includes heavy sweating,
Right.
cold, pale, and clammy skin,
Right.
fast, weak pulse, nausea or vomiting, muscle cramps, tiredness or weakness, dizziness, headache, and fainting. Is that what happened to you, Darrell?
Yeah, those are all the signs of heat exhaustion that come before. So if you get any of those, then you know you need to get an air-conditioned environment and drink a lot of fluid and stop doing whatever you were doing.
But
These are, since we're getting ready to go into July and August, which are months in which we get up to temperatures of 100 and above, it's good to keep these comments in mind. Any other questions about it? Thanks, John, for the laundry list.
Yeah, the other question is, Dr. Callender, Dr. Scalaberry spoke about other things that can add water. Well, I was full of watermelon before I had my liver transplant. And when I went to the operating room, they couldn't even close me up because I was too full of water, because they had a watermelon eating contest.
That's interesting. The other thing that you have to keep in mind is if people are drinking too much water, then salt tablets could be helpful, because the side effect of overhydration is hyponatremia, and salt tablets would help if that is a concern.
Dr. Callender, didn't we have well, somebody reported about a person that died from drinking too much water?
Oh, it's not uncommon. Yeah, because drinking too much water causes low sodium, and low sodium it can be a fatal condition. Yeah, but salt tablets would prevent that.
Yeah, when I run marathons, it's usually around mile 20 that I'll take a salt tablet. But along the race course, I'm drinking a couple of ounces of water every 10 minutes.
Right. Okay, let's go to the slides. By the way, the first thing I saw when I got in Phoenix, Arizona, was this poster with Velma Scantlebury on it. So it's good to see you. It's good to see you there in Phoenix, even though you weren't there, Dr. Scantlebury.
What poster was that?
It's a kidney poster that has you featured on it as the first African-American female transplant surgeon. It's a very nice poster.
Oh, wow. How nice.
Yeah,
You know,
it was very, very attractive, very attractive. It was excellent. It was nice to see you there, even though you weren't.
thanks.
Uh, Now, this is an article on bird flu, and I think it was an article to let you know that the flu can come from various sources, zoonosis, and the water birds, and other birds have this avian virus that can be transmitted to people. You can see pink eye can cause it, and other symptoms from this virus that can lead to respiratory failure and death, but not very common, but it still occurs. Often the symptoms can be feeling badly, feeling sick, and it's interesting how droplets of dust from birds and other animals can affect us. And of course, the Spanish flu, which is well known that in 1918 is, of course, the flu that we all know well as the coronavirus is now the pandemic. It's only areas where you have a lot of birds, but most of the birds don't give us the avian flu. But in Colorado, they found it. But it's not common, but it's something that you need to be aware of. Now this just showed just about everybody's has tested positive, from the presidents to the vice presidents to Tony Fauci, and he had positive and symptoms as well, and isolated and worked from home. So that while vaccinated, you can still test positive, as we all know anyway, and get reinfected. In case anybody wondered, this was just to authenticate the fact that this happens. And reminds us again that the purpose of the vaccination, though, is to prevent hospitalization and death, and that the reinfection can occur, but the likelihood of being hospitalized or dying is minimized. That's the purpose of the vaccine.
How many people on this call have gotten COVID despite being vaccinated?
Yeah.
I have same thing for John Buchanan.
I have.
That's what, 3? Anybody else? And Janice and
Yes.
anyone else?
Not me.
Anybody else? Welcome back, Kevin.
You're
Missed
welcome.
you. Missed you.
I didn't want to get too hydrated at the golf course today.
Okay.
Miss
And
y'all.
I didn't realize Fauci was 81 years old.
Good, doing well too, huh? Yeah.
I felt good when he got it, because I was one of those, I did all the right things. I won't get it. I protect myself. I'm in a bubble of people. And when I got it, it was like shock, but it proves anybody can get it. You can protect yourself. You can wear your mask. You can get vaccinated. And luckily for me, I didn't have any bad side effects. And I guess that's why. My problem was I stayed positive for 11 days. So I don't know if that's normal, good, or bad, but I wasn't sick with it.
Oh,
But
you're
I
not
did
sick.
I did
Doctor,
quarantine.
Doctor, does the vaccine now protect against the variant that's out there now?
Yes,
Okay. I mean, I have so many more people I know that's infected now than the last 2 years.
right. Mhm. Yeah. Yeah, now, one thing that is problematic is that those who get the new infections may or may not be protected against other variants. But
Okay.
the vaccine uh, is purported to protect you against all of the variants so far.
Okay.
And that's interesting, though, the fact that there's 17 people on this call. And so far, is it only 3 or 4 that have been reinfected so far? Hmm. I'm surprised. I would have thought it would have been more. Yeah. Well, it's interesting. I noticed that just about everybody as of July no longer will be required to be masked, and everything will be optional as of July the 1st. It's interesting how far we've come, although what will be the price we pay? I think because the number of people who are vaccinated is approaching 70% and beyond, that this will become less of an issue until the fall, I guess. But we shall see.
Well, after July, are they still going to require masks at medical facilities?
That's a question. Now, so far, we have received no information in medical facilities. We still are requiring masks. So it's going to be interesting to see what happens. But other places are doing away with their masks, and masks are now optional at most places. But as you pointed out, medical facilities are still requiring masks.
And that's important because as an institution, a medical institution, you don't want to be liable for someone saying, I got it in your hospital.
Absolutely. And that's why Joint Commission and Department of Health go around and require that the hospitals wear masks, and not only the mask, but the glass thing protector. Yeah, so that both of
Face shields. Yeah,
face shield.
field
Right.
shields, because hospital infections are monitored and you get dinged for them. So including COVID. So for all patients coming in, even if you're not vaccinated they're probably going to be checking to see whether you have it, just as they check to make sure you don't have any hidden skin wounds or breakdown. The goal is to make sure you're not bringing anything in.
Yeah.
Dr. Callender, I was in Children's Hospital, Children's National Medical Center on Tuesday, and masks were required, but some people bringing in children did not have masks on, and they were not accosted by the security people either. So that was a little strange for me. But I have a performance there tomorrow, and everybody has to do a COVID screening. Everybody has to have their vaccination card and wear masks. Even if we're outside in the hospital, you still have to have a mask.
That's the safest way to be. Yeah. Okay, next one. Now this is interesting because this is a question that has long been asked. How do we prove that we have immunity? And so these scientists have created a test that indirectly measures your T cell response that lasts long after antibody levels fall off. So when this is going to be available is another story, but they do have that test that can tell whether you can fight off the infection or not. it's a new finding. That it doesn't say when this will be clinically available, but at least we have it now. So sometime within this year, it may well become available. It's interesting that many of these new things that we talked about earlier in the program are in the Journal of Nature, but generally don't get to the public now. Dr. Scanterbury, what did you think about the I don't know if you were on the program when I talked about the new liver thing that can keep livers alive for 3 days? You have any thoughts about that?
Oh, the normothermic liver perfusion.
Yes, yes.
Yes, certainly it allows for. There were some papers presented at the ATC that were talked about the outcomes of these livers and allowed for many more to be used that would have been turned down in terms of being able to see how they work. You know, usually the ones that when you go to a donor and you do a biopsy and it has more fatty tissue than you want, or you're not sure whether a lot of those livers don't perfuse well, or they may perfuse, but they don't make bile. And so you end up having to retransplant the patient. And so the advantage is that, yes, you can then use the normothermic perfusion to see whether that liver is really going to secrete that bile that looks normal and be able to biopsy it, you know, within 24 hours to decide whether you can use it. So it does allow for a lot more questionable livers that would have been discarded, because nothing worse than putting a liver in and then have it not work. And then you're looking at an urgent retransplantation, which then causes the patient to get encephalopathy. And even if you replace the liver, may not wake up. So certainly it's a good avenue for allowing for use of more livers that would otherwise be discarded. I'm not sure, the article says something up to 70% of livers are not used. That number is really high. I don't know that I agree with that.
You use the term encephalopathy. What does that mean?
Generally with once the liver is not functioning, then there's a buildup of ammonia. And so when the liver in that acute phase after you put the liver in, and now you have dysfunction of the liver and it's not able to clear all the waste products that occur, then you get buildup in the brain. And so the patient is not able to wake up because if they weren't in an induced coma, they would otherwise will go into a comatose state, because the liver is not working. So you can't, sometimes they'll bring the patient back and put them on bypass, but that's not generally feasible. So then the urgent state is to be able to replace that liver as soon as possible, to get rid of all that ammonia that's built up in the system. Generally with an awake patient, you'll give them lactulose and try to help clear the ammonia. But it can be devastating in that if you don't get that liver replaced, yes, you can help reverse some of the clotting abnormalities that occur because of the fact that the liver is making those clotting factors, but it's the brain that suffers generally from prolonged liver dysfunction.
What is the prep process for an organ? We're talking about livers. Of course, I'm familiar with liver with my husband, but do you just take it out of the donor and put it in the recipient? I know you don't wash it, but what's the process?
You perfuse it, you keep it, when the goal is, if you go to look at the liver, and because the liver is going into the same location, generally you want it to be not too much of a size discrepancy. Sometimes you can go to get a liver and you realize that this is a large barrel-chested person, and the liver is too big because it protrudes out of the rib cage, and the person you are putting it in doesn't have that same frame. And then in that location, you may decide, this liver is not going to function. This liver is not going to be appropriate for that person because I'm not going to be able to get it into that space. or you may get there and the liver is looks like a little bit, we have what we call, a lot of patients suffer from non-alcoholic steatosis, fat buildup in our livers now, even people who are not fat. And so you get there and the liver looks a little bit yellowish from too much fat. So you may biopsy it to make sure that the percentage of fat is not more than 30%. And then you may decide not to use it, or you may decide to use it to someone else. But then you're going to remove that liver. You're going to put it in a container with keep it cold down to 4 degrees. And then you're going to flush that liver. You do it, flush the liver before you take it out while it's in the body. After everyone agrees it's the right time, you put ice around it so that you can keep it cold while you're doing all the dissection to get it out. And then you flush it again on the back table. And then you put it, you sort of wrap it in the sterile containers and you transport it in a cooler to wherever the institution that you're going to be using it in.
I often wondered, what is that whole process? My husband had a transplant out of state, and we received a phone call at approximately 7 o'clock, I guess it was 7:30 in the evening, and we had to go to North Carolina. We weren't even at home. So we had to rush, get home, grab a few things, go to North Carolina. And I remember getting there at 1:30 in the morning, but he wasn't transplanted until approximately 6 p.m. And it just seemed like such a long delay. I was wondering.
It's not, the delay is that when, let's say they know you're going to get the liver, and so they want you in the hospital, so want you to come in so that they can draw your blood work, make sure you not have any infections, make sure you clear it for surgery. But in that meantime, wherever the donor is, you have to remember there's a coordination between multiple teams. Let's say the heart's being taken, the lungs are being taken, the liver's being taken, the kidneys being taken, the pancreas is being taken. So you have at least 4 teams there. Some teams may arrive before others, but nothing can start until everybody is there. And the heart team, usually there may be a delay in the heart team, and sometimes the donor surgery itself is often coordinated around the time of the heart recipient. So we may be there all at the table waiting, you do your dissection, you're ready to go. And the heart team, the heart cannot come out until the recipient on the heart end is in the room and that operation is started. So oftentimes, if you're in the donor surgery waiting, the recipient on the heart end may not be ready. So everybody waits until that heart patient is ready. You may wait 2 hours or 3 hours, dependent to coordinate with the heart, because the heart can only be out 4 hours. So wherever they're flying, they have to make sure that's minimum time. And so it's important to do that. So we may end up sitting on the bench waiting for that to happen. And then, so once the heart team is ready, then everybody there, then we proceed. And the dissection is all ready. We put our clamps in, and you perfuse the organs with the cold solution to flush the blood out of them. And once that's done, then the heart team takes the heart. So everybody still waits for the heart team. That may take 15 minutes or so. They take the heart out. Once the heart is gone, then the lungs come out. The lung team takes theirs. And while they're doing that, all the other organs are surrounded with ice to keep them cold after they've been perfused. And then the liver comes out. Then the kidneys and the pancreas, kidneys are the last to come out. Then they're all packaged. And depending on the team, how far away they were, they then fly back to their location. And so once they get back to their location, then if it's in the middle of the day, generally you're waiting for an operating room to open up unless you have your own specific transplant room. And so therefore, we know that the liver may not have come out till early morning, depending on when the team went to the OR. Most of these group team recoveries are done like 4, 5, 6 o'clock in the morning, to coordinate with getting back to the institution.
Thank you.
What isn't known is that in the early days of our liver transplant, program. Dr. Cannonberry came down from Pittsburgh and helped us with the liver transplants.
I have a question, Doc. What is the requirement for a liver transplant? Is it blood type? Is it HLA match?
Generally, it's blood type and body size. Generally, you want to make sure that it is not too small to fit in. You don't want it sort of flip-flopping if the space is too small. And you want, it depends. Some people have very narrow rib cage, so you look at the size to make sure it's not going to be a discrepancy. Generally, with a bigger person, you can get a liver in there, but if the person is small, you can't get a bigger liver into a smaller space because it goes in under your lower rib cage.
But the blood type is the most important factor.
Yes.
There.
Yeah.
You know, I'm thinking this whole process would make a fascinating documentary film. Are there any films of the process showing the donor and up to 4 recipients?
Yeah, I'm sure there's some on YouTube. I have to check that out. You mean the actual donor process in the OR, taking it out?
Yeah, taking the organs from the donor and then following up with including footage of the recipients getting their transplants and then after recovery for the recipients.
Yeah, generally most people frown on that in case things don't go well. So they may film it and decide to whether or not they save it for a later date. But oftentimes we'll do it in a living donor, and sometimes there are documentaries of separate portions of the surgery, either that and the implantation. So yeah, there are different operations you can find that are online, but not all together.
I think one of the bravest surgeons I've known is Samuel Coombs, who did his live donor transplantation on TV. And that was remarkable. Although there have been others who've tried it and they've had dire consequences. But Sam was brave enough to do it on television, and it was successful and resulted in many others wanting to donate. Okay, well, that's interesting segue because John has been telling us about his friend Chris, who has not yet joined us, but maybe one day he will join us and we can talk more about that. Now, this article is about the fact that you can get long COVID with a breakthrough infection, and that's something that we don't know much about, because long COVID has not been something that many people talk about. We talked about it last week in terms of the fact that symptoms may cause so many consequences in the different organ systems, including the brain. And we're going to subsequently encounter an article that addresses the mental health consequences of long COVID, which can be very serious. So the answer is that it reduces, but does not eliminate completely the risk of long-term long COVID. But since you've got a vaccine that's about 85 to 90% effective, then of course that means that it reduces the likelihood of getting COVID that requires hospitalization or death or long COVID, but it can happen. So the more we learn about this, and one of the articles will tell you that there's a number of people who have symptoms of COVID for as long as more than a year, and some of them have had mental health consequences, which we'll talk about when we encounter that article. Well, it's interesting that whatever you do, that's great. You have people who try to mess it up. And these COVID scams, this is just an article that talks about over the decades, there have been different scams that have been associated with the different pandemics. You can see that during the Russian flu, they good old castor oil and some cures of electric battery, bronchial inhalers, and so forth were used, and even a rubber ball with carbolic acid. And some of these treatments were worse than the disease. And so this was just to alert people that misinformation is nothing new, and fraud's nothing new. And actually talk about hydroxychloroquine, which you remember somebody famous talked about that as a treatment, which it's not. But anyway, there's been all kinds of scams and even using Viagra and Xanax as treatments. And then, of course, the fake test issue that occurred, so that you have to, whatever we do for good, there's somebody out there who's going to try to mess it up and make a scam out of it, make some money out of it. So this is just to alert you. Sometimes when they say it's too good to be true,
It is.
that's accurate. And that's what scams are all about. Getting people to think that some things that aren't true are true and taking advantage of it. Yes, Bonnie, you want to say something?
No, I was just saying, that's true.
Yeah, so, well, anyway, just to alert us that fake tests, fake vaccines, fake treatments. So. And then not to speak of the charities, of course, one of the greatest ones is the Black Lives Matter charity fraud, which caused a lot of attention. And then, of course, now it's interesting, there is a legitimate COVID funeral assistance program. And the only issue is that you must have the diagnosis made. And then if you do have it made, then you can get assistance. Okay, Sylvia, sorry, gotta go. Nothing like keeping your teeth healthy. Now, this is an article I wanted to share because often when they talk about physicians making a difference, they leave out the Black doctors. Well, they didn't do that in this case. I wanted you to see some of the Black doctors who have made a difference. Of course, this is Jerry Abraham, who I'd never heard of before. And it talks about his contribution because he was willing to demonstrate altruism, compassion, and all the other things that are part and parcel of what being a good doctor is all about. This talks about his contribution as an AMA member. As you recall, initially the AMA would not permit Black doctors to join them. And as a consequence, the National Medical Association was created. And they have, of course, since changed their MOs, and Black doctors are now allowed to join them. This is a female doctor who has been recognized because Blacks and women were late in terms of being recognized for their contributions. And so this is a woman who was recognized.
Dr. Callender,
Yes.
one thing that's interesting is that you mentioned that there was the American Medical Association, and then they wouldn't let Blacks in, so they got this organization, the National Medical Association. Well, the exact same thing happened in the legal field. They have the American Bar Association, which didn't allow blacks in, and now they have the National Bar Association. Same
That's
thing.
correct.
And
Yes.
also,
They have the same thing in demo too.
Yes,
and,
that's
and
right.
the same thing in music too. They had the local 161. They wouldn't let blacks in. So now they let blacks in and they call it local 161-710.
That's so sad. Human nature is so sad. This is Lonnie Bristow, who was the first black president of AMA in 1995. He's now been around for more than 50 years and it was the pioneer in health equity and policy reform. Lonnie Bristow was a real pace setter back then. And this is the LGBT Health Award that was given to a black woman who did outstanding work, leadership in policy making, LGBTQ policy. So I thought it was nice to identify we've come a long way in terms of recognizing people who have made a difference. And of course, I guess the among the latter things to be recognized is the LGBTQ issue, transgender issue. And it's interesting how they now use as a badge queer, which in the old days was thought as not to be desirable, but now it has gone full cycle and they use it liberally.
Dr. Callender, with the LGBTQ community, doesn't that bring on a whole new set of diseases, especially sexually transmitted diseases and other diseases?
Well, that's not new. That's not new. That's old. As sexually transmitted disease has been with us as long as there's been men and women. No, not a new set. No. Now this is any other questions about it? Because this is something that we've always known, that racism and stress accelerates immune diseases and immune aging. And this study just demonstrates, proves it once for all that everyday stresses and discrimination is the risk of cancer, cardiovascular disease, and infections. And so this paper demonstrates once and for all that racism is not healthy. It's not good for those of us who are targets and those who practice it. It's not good for them either. I think Martin Luther King was among the first to preach that racism isn't good for us and it's not good for them either.
That's true.
But it's just that we are we're hurt the most by it.
And it is true that it is a certain amount of stress that we don't associate with it, but certainly as you go through your daily life dealing with the microaggressions and the racism, it takes a toll. And I think for many of us as Black people, we get to the point where we say, I don't know how much of this I can take once you're able to walk away from it. And I know for me, in leaving, you realize that your health has been so poor that when you leave, decide to move away from the situation, then you feel so much better and you're able to say, God, that was really stressful.
Well, I think few recognize how much you had to go through, not only being Black, but being a Black woman. So that's another level of stress that maybe is not as appreciated as it should. And I think that's why the recognition you received as the first African American female transplant surgeon is important.
Well, thank you. I feel like my career has ended earlier than I wanted it to, but I also felt like I needed to live more than I needed to be a transplant surgeon.
Well, you've been
Right
talking
choice.
you've been talking about it for about 10 years. Velma would call me and talk about, I think it's time for me to retire. I said, well, at that time, there weren't there were many other African American female transplant surgeons, so she couldn't do it. But anyway, it's interesting what you've had to go through. I remember when I first met you at Pittsburgh. What you had to endure is just beyond belief. But anyway, you successfully negotiated, so congratulations.
All with God's strength and mercy and his grace.
Wonderful, wonderful. Now, this is an article that's not new to us. I think Daryl and many others on this group recognize how unhealthy diets associated cause not only obesity, but chronic diseases. And what often is not recognized is that this is an issue that is an immune problem as well as a mental health problem. And that those people who have BMIs that are 30, 40, and 50 are people who have emotional issues as well. So it's not only the slow BMI, but it's also other factors. And the psychoneurological aspect of obesity, as well as psychoneuroimmunological aspect of obesity, is often unrecognized and unappreciated. But it is nonetheless, and it talks about the stress, discrimination, poor sleep, unstable housing, and all that. How, and of course, insomnia plays a great role in overeating. Any other thoughts, ideas as we talk about these stressors?
Dr. Callender, what I was a little unsure about that definition of food insecurity. What does that mean to you?
Well, to me, food insecurity means that you may, what food deserts are.
Yeah.
In other words, eating the wrong kind of food because of economic issues.
Yes.
Okay.
And so sometimes we forget that people of color don't have the opportunity to, because of economic and other reasons, to eat the same kind of food that people who have social, who are economically well suited. And so they have to eat at McDonald's and those other places because it's cheaper. And to me, that's a form of insecurity that leads to obesity.
The
And to
food
me,
that's good for you is expensive, and the cheap food is bad for you.
Right. And
unhealthy.
the fact of the matter is that the food insecurity is contributed to, influenced by the things that so many factors that makes it, when you say insecurity, you don't know where your next meal is coming from. So you don't have enough income, you're unemployed,
Right.
you're disabled, you live in an area where you cannot buy the things that the food is not accessible. And so you may be living in a food desert that may not necessarily have the things the good food. So you live in a food desert when there's only the Chinese and Chinese rice, and there's New York fried chicken, and there's all the unhealthy food. So you don't have access to decent grocery stores. And one of my patients, that patient was saying, you need to eat an apple and a yogurt a day. He goes, they don't sell those at the bodega. So where am I supposed to go get those?
Right.
So those are food deserts. But the food insecurity is that just as is like having a house insecurity. You don't have a place to live. You don't have that money to buy food. You're disabled. You don't know where your next meal is coming from. And so those things contribute for the inability to buy food is limited. And it's also may not be available. So unfortunately, that is so much of a lot of our underserved and marginalized communities live in those areas where there's lack of quality foods or even access, or not even maybe have the means to get those foods.
Yeah, one of the best examples of food insecurity are the homeless, because
Right.
obviously they don't have money to buy food, but the food that they do get, you see a lot of homeless people that are obese because the food that they do get, it's greater fat in the food, and it goes more to greater body fat.
Right. When you can go get, biggie size for $1 or get the dollar meal, they're not the greatest meals, but they're cheap.
Yes, and also I have worked with family and friends as a coach, and I've demonstrated how if they bought $30 worth of fresh vegetable, how they wash, freeze it, steam it, and come out. This thing that fast food is cheaper than fresh food. You have to prove to them that they get more for their money when they can wash it and freeze it and steam it versus go and get that. But in some places, I've talked to some customers, in some places, the only place they have is Walmart, and all the vegetables are limp. And so they have to eat something. So they either eat canned fast food.
Right.
I've even had to teach them how to look at like frozen beans. Frozen beans has less soda, green beans has less sodium than anything else. So the fresh frozen green beans is better than the canned food and the fast food. And so it's like reteaching people to think differently, thinking that, oh, if I buy this fresh food, it's so expensive. But when you wash it, freeze it, steam it, you come out way ahead.
Yeah, something else that come out way ahead. I got a lot of friends. I shop at Whole Foods Market. I have a lot of friends that call Whole Foods whole paycheck because the prices are more expensive than the other grocery stores. But okay, the deal for me is since I don't eat meat, I pay more for fruits and vegetables at Whole Food, but overall my grocery bill is lower because I don't eat meat.
Well, I think this is very instructive. The next article is explores the link between mental health and cardiovascular disease. This is something that in the past has not been recognized, that if you have bipolar, major depressive disorder, schizophrenia, that you have a mortality rate 2 to 3 times higher than that of the general population, and leads to a 10 to 25 year decreased life expectancy. And in the past, I'm not sure that we recognize the price you pay for mental illness, and why it's so important that these illnesses be treated, because we die from the cerebrovascular and cardiac mortality rates that are increased. It's probably something that we've not recognized before, because we just say somebody's mentally ill and don't think about the short and long-term consequences. And so to me, this means that it's so important to recognize. Of course, depression results in many instances in suicide, and schizophrenia and bipolar cause many other problems. So I think in addition, those people who have these issues also smoke more, drink alcohol more, and abuse more, and have less physical exercise. So these are all reasons why these people require more attention, but get less attention, and why, Biden talked about the need for mental health treatments, but this is another level that identifies why. Avoiding and putting those people with mental health issues on the streets, just throwing them out there, is very unwise. Of course, the group that really is frightfully abused is the veteran with the PTSD, and they killing themselves at a rate of one every hour, I think is what they said. So that suicide and other issues result in increased morbidity and mortality. More heart disease, more everything. What can we do? We need to have a system that allows for mental health to be treated. Right now, many psychologists won't accept insurance, which means that if you only have insurance, you don't have cash, your mental health issue may not be able to be treated. So I think this is an alarming problem that is swept under the rug. Any other comments? If not,
yeah, a lot of these, unfortunately, like you were saying, a lot of these disabled veterans and people who have mental disorders are on Medicaid, which doesn't pay for therapy or appropriate therapy, adequate therapy. They get these through the disability office. They have to go through such hoops to get appropriate medical mental health treatment, and then there's just not enough mental health facilities or workers or advanced practitioners out there. We had this question in one of our sessions, is that, there are people who are in dire need of finding someone to find a mental health therapist, and there are just not enough around. There's just not enough to, at least even within the Black and Brown communities, it's hard to find. People say, well, I need someone who's sensitive to my needs and can understand me, but they just aren't enough.
You make a good point, and that brings on another issue, that the people who need the mental health facilities and so forth, and they can't pay, they can't afford it, that within itself can cause stress and more mental disease.
Absolutely.
yeah. Okay, well, that's our Achilles heel, among others, in our society. Yes.
Yes, Dr. Callender. One thing that happened to me as a retired teacher is I had 25 students, and out of that 25, 10 had some problems, and they've been having those problems since it was recognized as having those problems upon entering school. Okay. And they went all the way through the system, and they got to the 6th grade with me. And I knew in 6th grade, I was the last homeroom teacher that they would have, that someone would look at them holistic. And I kept trying to get service for that group. And I got all this pushback. I even had one child that was going blind. And I had one child that would cut herself. So I had, it's just that I had the insight to know that something just wasn't right. And I kept working with the kid and the kids. And I went through the proper challenge and everything. And I had I lost your paperwork. It's a good thing that I always kept an extra copy of everything I had. And I just kept pursuing it, and the parents was backing me up. I knew they needed help, but I just didn't know what particular kind of help. And even though I had 20 years of experience in the health field, that wasn't my field. And so I kept pursuing it. And finally, the last week of school, someone from DCPS came down, and she happened to be a neighbor in my neighborhood. And she came to me personally to thank me for pursuing this, because every child that I had submitted the paperwork on countless of times was diagnosed with some concern. And so we just have to, constantly be observant.
And advocacy. You have to be advocates for when you see something's not happening.
Dr. Callender, you're talking, but you're muted.
Yeah, okay. This is an article that thank you. This is an article that talks about the impact of social isolation has on our brains, and the fact that during the pandemic, social isolation became the buzzword, and it's devastated young people and actually the old people. And sometimes we wondered, what is the price we pay for the social isolation? And now we're identifying that there are actually brain regions that demonstrate that this is actually negatively impacting our brain function, and that social interaction aids and facilitates maturation of the brain. And so groups like this and other kind of groups are very important to maintaining normal brain function. And of course, we know that that's among the reasons why church attendance is helpful, because you develop social groups that help you. And it's also identified, as you can see here, that those who are isolated had a 26% increased risk of dementia. And so there's every reason to recognize that, and then that's another reason why our pupils who couldn't go to school anymore were so often depressed and suicidal, and also lonely. And loneliness has reached epidemic proportions as well. And this is particularly important for those who are older. So I guess the bottom line is that that we are meant to work together and not be socially isolated. And if you are, there's a negative impact upon your brain function. Any other comments that you might want to make about something that is common sense, but may not have been as appreciated since the pandemic required it?
I have a comment about the social media aspect. Video conferencing like we're able to do is a lot better than just the telephone, but the phone, Zoom, video conferencing, all that is better than being totally isolated. But a lot of my friends who use the Zoom platform are complaining that they want in-person relationships rather than over the internet. So is there any research into that? Why?
Yeah, there's a lot of research that identifies that nothing beats face-to-face. So the sooner we can get back to that, the better off we will be. With MOTEP, one of the things that has helped us to be successful is the face-to-face contact. And the social media has its place, but it does not replace the face-to-face and person-to-person contact. And many feel that much of the reason for the increase in mass murders and all this other stuff is the lack of social interaction and the actual lack of interpersonal relationships.
There's nothing like a hug.
Yes.
Back on that, the face-to-face versus virtual. A lot of people truly enjoyed working from home over the last couple of years, and now they're being asked to go back to the office. And what I'm finding is that the people who otherwise have good social interaction outside the office, they want to continue working from home, because people working face to face inside the office, they can't get anything done because people are always wasting their time, getting in the way of actual work being done. But then on the other hand, people who can't stand, like say, if a woman works from home, her husband's retired, she can't stand him, and she wants to get away from him to go to the office. You have those dynamics going on.
Yeah, what about this one? People love working from home because they don't, they can work in their pajamas, a cup of coffee or whatever. But when work is over, then they go out and party in person, go out to clubs and everything. They like that.
Okay. Now, this is, in many ways, this is a funny article in the sense that the benefits of exercise in a pill. And at first, when I read the article, I wondered, why would you want to put it in a pill? But then you find that, as it says here, older or frail people, people who have osteoporosis, heart disease, other conditions, may not be able to exercise. And so if you could find out what greatness that occurs from exercise and put that in a pill, that might be able to help those people who are fragile and couldn't exercise. So I initially wondered, why would you not want to? But there are a group of people, small though it may be, who can't exercise. And so if we could have what the consequences of exercise and put it in a pill, that's food for thought. Anyway, that's the essence of what this article is all about, identifying the fact that physical exercise is important for life, but there are those who are too fragile and can't exercise. So what do you do for them? And this kind of is why they're researching, to trying to find out if you can actually mimic the consequences of exercise and put it in a pill. Hasn't been done, but it's food for thought, and it's research that could be fruitful. Any other thoughts on that concept?
Dr. Callender, they say that we are living longer nowadays. And one of the reasons is because of the myriad of pills and things that we have, medicines and so forth, that's causing us to live longer. So this seemed like one incident of that. Somebody 104 years old can't exercise and everything. You give them this pill and they might get another 2, 3, or 4 years out of it.
That's the thinking.
Hey, Dr. Callender, I sure hope our tax dollars aren't paying for this. Because, anybody can just walk and stand in place. Or if you in a chair, lift your arms or, lift your leg. It's another way of trying to, I don't know, get around what you need to do. But I'm just appeal for exercise.
Well, there are groups of people that can't do those things. They are small groups, but there are groups of people who are so fragile. And as John said, if somebody's 104, maybe they can't get around. So I agree. For those who can, it's tough to beat it. But for those who can't, maybe pill might be helpful. Well,
Yeah, I think a pill is a great idea, but one thing it can't do, it can't give you muscle strength. And at the end of that article, they were talking about what increases the lactate levels in your blood. And it said number one was sprint training, followed by resistance training, followed by endurance. And usually, okay, when I run, I do speed work once a week, which is sprinting. And I felt my best always during the sprinting compared to resistance training or endurance training. But
And
you
they are
think about sprinting. That's all the little kids do. It keeps them young. But they run. They just run short distances all the time. That's being a little kid. You act like a little kid, you'll stay young.
When you
and
say
they
that,
are and they are
excuse me,
exercise.
hello.
Go
When
ahead.
you allude that we are living longer nowadays, how can you correlate this saying with the fact that in the Bible we know people were living 400, 500 years? What type of exercise or food were they eating in those days?
I have no idea. We know that Methuselah was 900 plus years. And of course, I don't know the calendar they had in those days. And I don't know 900 years is equivalent to with our calendars. But it's certainly clear that after the flood, the length of life is shorter.
Mm.
Now, this is an article that talks about the dire consequences of sitting.
Dr. Callender, I wanted to go back to when somebody just said that after the flood, the length of life was shorter. That's because they were more stressful about dying after the flood.
They were what? More what?
They were more stressful and they were fighting each other. And they were, after the flood, it was many more people after they populated. And so after they repopulated, and then they were probably wondering, the stories of those who have passed on. So there was the intervention of stress.
Well, not exactly. If you read Genesis, it'll give you the generations of Adam, and it'll give you decreasing lifespans all the way to I forget which biblical patriarch where it reached 120 years, but it went down from Methuselah, but it consistently
Right.
That's
From
after the
Methuselah.
flood.
Yeah, that's why I said by then it started to multiply.
we got our 410 or 310. We got
Right.
that long before the flood.
Yeah. Well, that's
It was
an
just a
interesting,
joke. Don't take it seriously.
Okay.
that's an interesting area.
If you want to
research.
contact me after the session about why it went from hundreds of years in antiquity and why it is today, I can explain that to you genetically if you want to get with me after this session.
Now, this is an article on telling us that in many ways the bottom line is that sitting is the new smoking, and that basically, and I think Darren said this many times, and that we walk too little and and we sit too much. And our cardiovascular health and our early deaths are a consequence of sitting. So, and you can see it affects us, those in low income, lower middle income, more than it affects anybody else.
Well,
So,
well,
yes,
Dr. Callender, when we discuss the water intake, okay, if you drink your required water intake, it's gonna make you get up and move. So it's recommended that you move every 30 minutes.
So
we're gonna give you your
Or suggested.
yeah.
right. And
So
so,
if one is gonna have a balancing act, you know, you drink your water, you got to get up to move to do that, take care of that. But that exercise, nothing beats that exercise.
okay, and I guess so. In this group, there's not too many people who spend all their time watching television and all that stuff. They're out exercising, I hope so.
Yeah, Dr. Callender, I remember the podiatrist told us, right? For your feet health, make sure you stand up at least once every hour.
Yep. Okay, is that the last article?
We have 4 to go.
Okay. Okay. Oh, this is the article that talks about the new storage technique. It's almost 10:30. New storage technique, which we talked about earlier, and it's interesting how with this new technique that we talked about, that liver was stored for 3 days, and the patient is healthy a year later. So, and this talks about the issue of the time it takes to get a result from a biopsy and other things, and how in the past the maximum was about 12 hours. And so this could, in this article, it talks about what Velma had mentioned, that 70% of donor livers are not used. I was not aware of that either. And I'm not sure that that's accurate, but it's what it says anyway. I know that for all organs, it's 1 in 5, but I don't know about the specific number for livers. So, and this was about recovering livers that were damaged. So anyway, this is a revolutionary concept. This is, I thought this was interesting, not because of the fact that the United States Supreme Court made a reasonable decision, but because in the past, we made some very unreasonable decisions. And so this is a good example of making a good decision, but we've got to remember that the Supreme Court has made some horrible decisions in the past. And so we've got to not rely on the Supreme Court doing the right thing. They did in this case because they did something that would be good for all children. But also to remind us that they also were in favor of slavery and other things. So let's not put all of our eggs in the basket of the Supreme Court. And this may be an ungrateful statement, but people of color have been victimized by the Supreme Court in many instances in the past and sometimes in the present. So food for thought. Now, this is an interesting article to me that makes no sense, but a number of the scientists felt they need to rename monkeypox due to stigma concerns, which was mentioned last week. And so they are looking for a new name for monkeypox. to me, if it comes from the monkey, it should be okay. Why that should make people think about Black people in Africa, and the fact that it originated in the Congo Basin and has been identified more commonly in Africa is something that is thought to be stigmatizing. That's interesting. It's no more stigmatizing than coronavirus came from China. So I did. So you're going to change its name? Well, you can. So anyway, they're trying to come up with a new name for it. It'll be interesting to see what the new name for it is. But they don't have a new name for it yet. Now, this is an article that emphasizes, now this is tragic. 72% of men surveyed, they would rather do household chores, including cleaning toilets, than visit their doctor. 65%, they try to avoid going to the doctor at all costs. And 37%,
Yes, that prostate exam.
huh?
That prostate exam. Nobody likes that.
Yeah, that's one. Women don't like the vaginal exam either, but they get it. So that's a poor excuse.
Thank you, Dr. Callender.
Yeah, 37% of withheld information from the physicians. You know, and it's kind of disgraceful that we popularize the fact that men are so disrespectful of their own health and their families. And of course, the price you pay is that you wind up having more prostate cancer. Although, let's face it, if you live long enough, you're going to get prostate disease with enlargement of the prostate or cancer. But among African Americans, this is even more a problem. And the earlier you make the diagnosis, the more likely you are to be able to successfully treat it. Now, it's interesting that we call genetics the next frontier in precision medicine, and it may be. We have to also recognize the positive as well as the negative aspects of genetics, because many diseases that are genetic are not treatable yet. And if you have a genetic disease that's not treatable, then that may affect all aspects of your life. And so as we are able to treat some of these diseases, the benefit of genetic testing becomes more applicable. However, one thing is clear is that in general, and I think Velma and KDX emphasizing the importance of men getting health care, because it is so obvious to all that that's one aspect of the gender issue that is embarrassing, is that men are not willing to go to the doctor. Their wives have to drag them to the doctor, which is sad to relate.
You forgot the part of screaming and hollering.
Any other comments on that? Because it's lamentable, and whatever we can do to get more men to take seriously their health care, the better off we will be.
You know, Dr. Callender, my doctor did not recommend. She stopped doing the digital exam, and then I had to ask her to do the PSA test, and I think that test may be expensive. I don't know if they're.
It's not expensive.
It's not.
No.
I don't know why. You know, I had to ask.
Is she black or white?
She was white. Yes.
Yeah, that's why. Because the data identifies that in white people, there may be less of a issue with doing PSAs. And now, to me, rectal examinations is part of a physical examination, period.
Is it covered by Medicare?
Is what covered by Medicare?
That PSA test?
Yes.
It's preventive care. So Medicare is preventive care.
Yes, it is.
I asked because I've had some friends say in the past that some of the tests that they needed to have weren't covered by Medicare, and if they didn't cover it by Medicare, they weren't going to have it.
Right, but that PSA, I don't believe is one of them. But a rectal examination is just part of the normal physical examination.
Right.
And even though one might not do a PSA, which I think they should do, especially in blacks, not doing a rectal examination is a breach as far as I'm concerned. But then some people don't do physical examinations. You know, they want to do x-rays. So that's food for thought. Velma, you have any thoughts on that? You still with us?
Yeah, I'm still here. One of the things that we were talking about, the lack of rectal exams by the residents, and on one of the recent grand rounds before I left, and the attendants pointed out that there's no need to do rectal anymore, which I found quite strange.
That's sad.
Yeah, and so in that, you know, you can just scope the patient or do a PSA.
Oh, listen, you know, if you scope a patient, you may miss the rectal. There ain't a rectal.
Right,
issues.
right. And to not have enforced that residents need to be able to palpate a prostate, I guess only if you're a urologist, it becomes important. But yeah, I was quite disappointed.
Yeah, it's sad what's happening to medicine these days, and the lack of appreciation for the importance of a history and complete physical examination. And it's lamentable that your doctor does neither the PSA or the rectal examination in a black patient. It's difficult for me to hear that and not vomit. Now, this article is the last one.
Yes, I just stuck this in.
And we actually started talking about the high temperatures and how talking about we talked last week about the importance of sunscreen, and this is interesting for those who don't have air conditioning to run fans and have ice. But I think it's when it's up to those temperatures, you really need air conditioning. And this goes back to Velma's point about other things that keep you hydrated. and of course, we listened to John Tatum's watermelon issue.
You know, like for instance, with our patients, let's say for patients who can't drink a lot but wants to stay cool in the summer months, they usually recommend, especially for dialysis patients, that they use frozen grapes because they're a source of liquid, but you can also have them in small amounts. So you don't realize, so, you know, you stay cool. And so, yeah, watermelon patients often often underestimate the amount of liquid in watermelon, cantaloupe, all those things are just generally full of liquid.
These are little things that help. Yeah. Okay, Daryl.
Not cold shower. Ooh.
Daryl has told us about the beauties of cold showers, not cold showers. And we've learned a lot from Daryl over time, and this is another gem. Daryl gem. Signs, here we go, the same signs that actually John Buchanan had quoted before, as all of these let you know that if you get any of these, you better get out of the heat, get in the cold stuff, all of those. Of course, Daryl's exposure was dizziness and fainting for heat exhaustion.
Okay.
All right, that does it. 10:30 on the dot, and it's been a great
I've got a
session.
quick question for the group. I hope that you can give me an answer. Okay, I got a friend that has employer provided health insurance, but had emergency hospitalization and has thousands of dollars in out of pocket expenses. What's the best way to handle that? You know, like I realize that you don't pay your bill in 30 days, they ding your credit record. So, any suggestions? Best way to handle it?
Well, the first question I have is what type of insurance does he have? Third-party insurance does he have?
I don't know the carrier, but you know, it's
Probably employer provided. So
Well, it's
which
employer-
means the employer puts the money up. And that's how the insurance is when you have those high deductibles like that.
Yeah, he may have the 80-20.
that could be. But all right, more importantly,
Did he have to
what
pay
the
100%
person
of the
has is $1,000 of out of pocket that's due right now. So how do you go about handling that? Do you
Okay.
contact the hospital, work out a payment plan, negotiate a lower payment by saying, you know, hey, I don't have it. What will you take? Are there any plans that you could contact that will help you out on thousands of dollars of out of pocket?
Yes. If it's talking about the insurance paid 80 and his copay is 20, and because of COVID, there's also funds for that, and also he can contact his local government.
And the person use COVID funds if they didn't have COVID?
Okay, but there's also financial system because of the circumstances that we're all in COVID, and COVID has thousands of effect on people's lives. So you got that 20%. Sometimes that his local federal government or the federal government has resources to support him with that financial, and because of his income, they have sources for that too.
Well, we don't know what his income is.
Well, that's what he has to check his local. He has to check his local area government to see what health resources they have, because they do have them, and the federal government has resources for that. So he has to look at, in addition to making some arrangement, because see, because I worked in healthcare and I worked in the financial most of my life, the point is if you're a Black American in certain states, in certain hospitals, they're not going to volunteer that information, okay? It has to be a seek and find. And so those are the sources that you're looking for. You're looking for assistance to help you with your medical bill through your local community government and as well as federal government.
So
I have
specifically,
If you got a six-figure income, but you don't have six-figure savings, that means you're out of luck. You contact your local and federal government, and they say, "Hey, your income's too high. Go pay your bill." Is that what happens?
You know, Daryl, I would go to social media and start a GoFundMe page. A lot of people do that.
Oh, okay.
And it actually works. A lot of people, especially if it's a serious situation like what you're talking about.
any other thoughts or ideas?
Well, at least have communication.
My experience. Go ahead, Kevin.
At least have communication between you, between the patient and the institution, to show them that you're at least trying to get this straight. You know, just communicate with them. Not saying that, you know, that's not the answer. They're not going to pay the bill, but at least they may not put you on a credit report right away.
And also in contacting with the hospital of the source, see if they know any financial sources.
Exactly, yeah.
Yeah.
Okay, that's a good idea. Thank you.
What I was saying, with my experience when I was going through my cancer treatment, they provided some additional financial resources for me. And I had Kaiser, and they gave me an additional some financial resources. So I paid for no medications, no nothing, nothing out of the pocket. But yeah, but they need to check with their provider, who's there, like maybe it's like a social worker or something that should have taps on other resources that they can get tapped to within that institution.
Right. And also, my daughter was telling me about the new Surprise Law Act. Okay. So there's resources behind that as well.
Not familiar with that.
So that law says surprise, you got a big bill, pay it. That's a law that
No,
No.
that's the joke on that end, but no.
Any other thoughts or recommendations?
But that communication is so important.
Yeah.
Communication, emails, okay? You got to have your documentation.
Exactly. Yeah.
Yeah.
And he needs to keep a journal of who he talks to, when he talked to, and telephone number is all information. So he don't backtrack and, okay?
And by the way, I never said my friend was a man, but everybody assumed that it was.
Well, good luck, Darren.
We're trying to help. We're trying to help them out.
A human being. All we want to do is help.
I appreciate that. I was just laughing at the assumption everybody made that it was a man.
Because you're talking, you're a man.
Yeah, but I have men and women friends,
Daryl.
Any other comments to help Darryl with this situation that many of us could encounter? Because few insurance companies provide 100% coverage.
True. Absolutely. That's where the 80-20 come in at.
But
And-
I think his problem is more, he said employer-based. There are some companies that put money up for their employees, and they're not like under United Healthcare or Cigna or Aetna. They have their own company-based insurance based on the amount of money the employer puts up. That's a whole different thing. And normally those kinds of policies have the $1,000 deductibles, which means that you have to pay the first 1,000 before your insurance kicks in. Is that more like what the deal is, Darryl?
No, it's more like a 80-20.
Okay.
It's just that when it's
And he
20%
got into that
of
situation.
$100,000, it's a lot of money.
Mhm.
But there should be a cap, I would think.
Right. Right. And if this is his first illness, he has not reached that certain amount. And
Or
so
she.
it's all.
Well, he's
She
obviously
has
reached
not
that.
reached that amount.
But we're not going to say it. So it's either he or she.
LGBTQ. Yes.
We're going to say human being, okay? We're going to respect all persons.
I assumed it was a man because the men are out of money more so because women are, get supported by men.